Welcome, everybody. We are delighted to be here this evening. I'm Anna Maria Ciagarese. I'm the Dean of the School of Public Health and Health Sciences at UMass Amherst. And it gives me great pleasure to introduce our speaker today, Senator Joe Comerford. As you know, Senator Joe Comerford, or as she has told us, would prefer that we call her Joe this evening, represents many of our Western Massachusetts communities as she serves her second term as state senator. In her role chairing the Joint Committee on Public Health, the entire Commonwealth is benefiting from her leadership to address pressing health concerns, including chairing the critical Joint Committee on COVID-19 and emergency preparedness and management. She's also a huge supporter of our public higher education system, and we've been very fortunate to have her as a colleague in our school and having spoken to our students. And she's working to address climate and environmental health, all these issues that we are very much concerned about. Along with Senator Comerford, we're delighted to have all of you here this evening to join in this conversation about the HEALING Act. You are leaders in local health, students and faculty, and residents of Western Massachusetts. The HEALING Act is such an inspiring piece of legislation because it will lead our state policymakers to consider health equity in all policies. It is so on target of what public health needs to be doing. So for the first time, all 5 deans of the schools and programs of public health in the state of Massachusetts have collaborated to write an op-ed on how we need to be supporting this bill and other bills that address structural racism. So stay tuned to having seen that op-ed come out this week. And so without further ado, let me introduce Joe and have her take over. And we do want to encourage you throughout the session to please include your questions in the chat room. And at the end, we'll have plenty of opportunity to engage in a really rich discussion with Joe and Brian, who's here to help her answer some questions. So Joe, thank you once again for agreeing to be here, and we are delighted to have you join us.
Thank you so much, Dean Ciagarese. I'm so happy to be here with you and so proud to represent the University of Massachusetts Amherst. The Hampshire Franklin Worcester district, which is the Senate district I represent, is 24 cities and towns. It starts just about in Northampton and climbs up the Connecticut River, of course, passing through Amherst and the university, and then it hits the New Hampshire and Vermont border and it tees right to Royalston and left to Coleraine. I think of it as some of the most beautiful terrain in the Commonwealth, but it's also, and probably more importantly, full of some of the best thinkers, the best strategists, the best advocates. And in your case, in the case of folks gathered here, thank you, Dean, again, and Risa, who I'll thank you just in a moment for making this possible. You are focused like a laser on public health, on the imperative of public health, and of course on racial health equity. So thank you, it's an honor to join you. I want to just also welcome Legislative Director Brian Rossman, who's here. We also have Public Health Fellow Julia Wynette here. And also I see that Rachel Khanna is here. Rachel is from the University of Massachusetts, a student and now also an intern. And let me just say, as we talk about this bill, the health equity at all levels of government, it was made possible because of public health fellow and intern research, which I'll talk about, right? So students are helping to power the way forward. We couldn't do the work without you. So I've prepared about 10 slides or so, and we'll move through them so that we can have, as the Dean rightly said, a good question and answer, a good discussion on health equity. So I'm just going to share my screen. I'm assuming that everybody can see the screen. If you can't, it would be great to let me know.
Looks good.
Okay, perfect. Thank you so much. So again, we're here to talk about the health equity at all levels of government bill. As the Dean said, I'm the second term chair of the Joint Committee on Public Health for the Senate side. I also chair the COVID committee. It's called the COVID committee. It's the COVID-19 and Emergency Preparedness and Management Committee. I was asked by the Senate president to actually wrangle all of the Senate's COVID relief work during the pandemic. And I'm proud that, you know, in this second term, I have two chairs. And of course, they're very, very much intertwined with each other. So here's a big question to get us started. As we think about this health equity at all levels of government, and as we gather this evening, what would happen if we evaluated in the Commonwealth every single policy and budget decision by considering whether it would help or hurt racial health equity? That's the question that we asked ourselves as we saw the pandemic hit our shores and saw it sweep across the Commonwealth and really expose the inequities that we long knew were present. What would have happened if we had focused like a laser our policy and budget decisions on racial health equity with the goal of everyone having what they need to attain their highest level of health? And again, I want to shout out to DPH, the Department of Public Health, that helps us with a lot of this language because they themselves have been champions of racial health equity for a very, very long time. So as we thought of this, we thought of something called the Healing Act. So this is a very busy slide. I'm going to give you a second to look at it, and then we'll talk about it very, very briefly. So here I want to say the thing that we know to be true together. That health disparities, which are defined by the Department of Public Health as significant differences in health outcomes between populations, they existed in our Commonwealth long before COVID hit our shores. And you know, again, we could take a very, very long time to think about these stats, but I'll summarize them briefly because I know that there are many experts on this call. Black residents have a premature mortality rate 1.3 times greater than white residents. There's significant disparity in asthma rates for Latino and Black populations. There's worse overall health in general for the same populations. There's disproportionate inequity in prenatal care, and Black pregnant and postpartum people have much higher rates of what's called severe maternal morbidity, or SMM, 3 times the rate of white people. And the list here could go on and on and on. And again, these health disparities existed before COVID. And of course, there was inequity during COVID. Report after report talked about disparities in the number of tests available in communities of color, disparately large or increased numbers of cases in communities of color, disparate numbers of hospitalizations, and tragically, disparate numbers of deaths during COVID-19. All of this as the Senate and the legislature and you all were responding in real time to the pandemic and what we could and should and must have done to try to keep people well and help us move through what was this global event. Now, these slides are from the Health Policy Commission, these 2 graphs. Again, I'll summarize them for us. So I'm moving now from the evident health disparities to the health inequities driving these disparities. That's something that we also look at in the legislature all the time. So there are health inequities, which here are defined as unjust distribution of resources and power between populations that of course are evident in the healthcare system, right? And here again from the Health Policy Commission, you know, again, many of you may have seen these, but this looks at the cost of care on the left and the intense burden of the cost of care, especially on individuals of current low income. And then it looks at the avoidance of care, another inequity driving the disparities in health inequities in our Commonwealth. But we know that health and public health and health equity is more than, although it's really important, it's more than just our healthcare system. It's also many other factors. And this, of course, comes from, and you may have seen this before, the Bay Area, but it is a slide that is used very frequently with the Department of Public Health and certainly in the legislature, as the legislature grapples with these health inequities, these social determinants of public health that are driving the disparities and are themselves the embodiment of unjust distribution of resources and power. This slide really begins this emergent conversation and names race, racism, ethnicity, immigration status, gender, sexual orientation as some of the upstream determinants of the kind of things that make us well and keep us well, or drive the disparities, are embodying the inequities in our healthcare system. And you can see this, this conversation that, again, many of you are leading in your own work of things like education and employment, housing, climate, food security, as being, again, part of the health inequities that are driving the public health disparities. So all of this was top of mind for the legislature during COVID, and in law, as part of the COVID response, the legislature created a body called the Health Equity Task Force. And let me just say again to Dean and Risa, and without whom we wouldn't be here tonight, and thank you, Risa, especially for your unbelievable wrangling and the Western Mass Health Equity work that you and many other people are doing. So the legislature created this Health Equity Task Force. Dr. Frank Robinson from Western Massachusetts was a member of this task force. And this task force spent a year from August until July of 2021 looking at health equity. And this, we're going to talk about this Healing Act that our office has filed, that Brian and so many others have worked on with the council of many people in Western Massachusetts. But at the same time, there was a sister effort happening in the Commonwealth. And I really want to raise it up because I think it's so critical. And there is a profound intersection with the bill that we're going to talk about this evening. So I'm going to turn to the next slide, and I'm really going to give you time to take it in, because it's these 6 recommendations from the Health Equity Task Force. We're going to spend most of our time on the final bar. But please take a few minutes just to take it in. So this Health Equity Task Force was, again, thank you to Dr. Frank Robinson for being the Western Mass voice, and so much more than that. You've been leading in Western Massachusetts and across the state on racial health equity for a lifetime. It was chaired by Michael Curry of the Massachusetts League of Community Health Centers, and also Dr. Asad Sayah from Cambridge Health Alliance. Later on, we'll ping the link in the chat so that you can see the recommendations of the Health Equity Task Force yourself. And so that's a piece of context in which the Healing Act is born. And I'll start on the left side and I'll just go through all the way to the right, because of course, nothing here that we're doing tonight with the Healing Act is happening in a vacuum. The Health Equity Task Force saw the holistic need for a comprehensive set of policy decisions that would help focus equity as an organizing principle. So on the farthest bar is, of course, really just responding in real time more equitably to the COVID pandemic. The one in and going to the right, strengthening access to quality, affordable healthcare. That's part of what we went through very, very quickly, right? People in Massachusetts do not currently, even though we have a lot to be very proud of in terms of our healthcare, we still don't have reliable, affordable, enough healthcare. Still too many people have to make brutal decisions between their healthcare costs and other needs. And still there's so much difficulty and complexity disproportionate numbers of low-income folks are not accessing the kind of care that they need and deserve. In the elephant in the room here is, of course, Medicare for All, which is probably the preeminent way to strengthen healthcare access and quality. The next bar over is addressing social factors in health. And here we see food security, we see housing, we see inclusion and access for immigrants. So there's so many different pieces to this health equity task force in this bar. The one next over is something that's very near and dear to my heart. It's strengthening the local and state public health system. And I will say here that the Massachusetts Public Health Association has been integral, as have many in Western Massachusetts, in driving what we call a state action for local public health excellence, because we need the foundation on the ground in local communities to be equitably held so that we can work on that upstream piece of work, that graphic that we saw that's looking to get us further upstream in how we think about racial health equity and health equity overall. The next, of course, is equity and resilience in emergency and disaster preparedness. And coincidentally, I spent the day today in the Massachusetts Emergency Management folks at their bunker in Framingham. And we talked in part about equitable responses, right? How does MEMA, coupled with FEMA at the federal level, how did they ensure more equitable responses to COVID? And finally, I want to land on this recommendation from the Health Equity Task Force, again, which was happening at the same time, really, as we were putting together the bill to prioritize equity in government, in state government, right? And so what does that look like? It looks like, and these are the suggestions of the Health Equity Task Force, creating a cabinet level office of equity, creating offices of equity within every secretariat, so every single agency, making data, sharp data available, because of course we can't tackle what we can't see. We can't address what we can't measure. So data is actually a racial justice imperative, frankly. And finally, requiring an equity in all levels of government, policy analysis. So I'm going to move on now from this. And again, we'll ping the link so that you can have access to this, because it's very groundbreaking and very important work. That's one piece of context. So the Health Equity Task Force was one piece of context. The second piece of context, and I think it's really important to bring into the room, is that there are a lot of good bills filed, many good bills, in fact, 6,000 of them, and many of them quite strong and really wanting to address the ravages of COVID and the inequities of COVID. On top of the legislation, there's many commissions like the Maternal Health Commission, which I'm a part of, as well as doing this healing work, task forces and caucuses. And again, we're focused all together on issues of environmental justice, housing, wage, healthcare, maternal health, local public health, food security, and so much more. But now with this context in mind, let's pivot to the health equity at all levels of government piece of legislation. I'm really honored to have filed this with Representative Liz Miranda. We filed it for the first time in January of 2021, again, at the onset of this session, the 192nd session of the legislature, my second. And this, like the op-ed that the Dean mentioned, tonight's talk is actually very well positioned. This bill has a hearing on Thursday, October 28th. Which, we'll talk later if you're moved or interested to send a quick note in support of organizing ourselves around a health equity at all levels of government frame, then please, you are more than welcome. So I want to talk really as briefly as I can about part of the process of this bill. So in addition to learning from folks in Western Massachusetts and across the Commonwealth, in addition to doing our own research, our team actually wanted to branch out and see what was possible in other parts of the country, see what was being done. And we have 4 recommendations below, but I just want to go into a tiny bit more detail about what they're doing, for example, in Minnesota. So in Minnesota, there is a Minnesota Healthy Communities Act in 2008. It was proposed. The bill didn't pass, but the governor set up in response a Center for Health Equity, which led to a 2014 report on health equity and voluntary equity review process. And the reporting is used by legislators to judge the efficacy, the racial health equity nature of policy proposals. In California, the California legislature passed legislation. It set up a health impact assessment, which set up voluntary action plans for agencies, which included data collection. And as of the summer of 2019, they've done 84 assessments, which is a significant number when you think about how many bills will pass in a session. In Washington, in 2013, legislation set up the Health Impact Reviews of Pending Legislation, or HIR. It's objective, nonpartisan, evidence-based analysis, and it determines, these HIRs determine how legislative or budgetary change will likely affect racial health equity. So what we're talking about in Massachusetts has been done to some extent in Minnesota, California, Washington, and elsewhere. And let me boil down some of the recommendations that we heard from the experts on the ground, the health equity experts, the public health experts, the academics, and the legislators. Health equity has to be elevated way up. It has to be elevated to the highest level of government. Having it down in any kind of bureaucratic layer will not be sufficient. We have to address all the drivers of inequity, right? So we can't just think, oh, we're going to just do food security or we'll just do maternal health. We have to do a health in all policies approach because, as you saw, as we breezed through, there are numerous social indicators of public health. So we have to think of them comprehensively because they all intersect. The community must be centered and powerful. And here, let me just say that the Western Mass Health Equity folks really made this unbelievably clear as we shopped an early version of the bill in 2020. It was so crystal clear that we had to have a sharp interface with community that was real, that wasn't tokenized, where the community had a voice. And it's important to build the culture over time. In fact, people said pretty candidly that unless we take time to build the culture of health equity, this kind of necessary policy change just wouldn't be possible. So with that in mind, we set off on the Healing Act journey. And so let me talk about three broad principles of the Healing Act. First one, as we talked about, it builds a health equity culture. It actually writes into law that racism is a public health crisis. And it does work to create the second principle, structures. These are long-term permanent structures that are going to do the work and intersect with each other in very concrete terms. And these long-term permanent structures are both in the executive branch and in the legislative branch, because this health work of racial health equity can't just be held by one of those branches. And then the last is there has to be real accountability. And that accountability comes again through, as we talked about, data and getting it out up into the light in accessible forms, current forms, but also in communities, centered in communities that are most affected by racial health inequity. And so the bill tries to do this. And let me just say that there's a sharp and pretty, I think, exciting role for academic expertise as we've envisioned it. And I'm not going to read it, but you'll see underneath that we also try our best to define health equity in law. And we'll make sure that these slides are available. And of course, you can see the bill itself and look at this definition of health equity. So I'm going to flip now. And this slide, and I did try to do it a number of different ways to make it accessible, but let me just say that we think about the three principles, right? Culture, structures, and accountability. Those are the three principles upon which we hang this legislation. And the legislation itself has two phases. And there's two phases for the executive branch, and there's two phases for the legislative branch. And it's really important because, again, these three principles have to be seasoned in over time. The first phase in the executive branch it sets up the entities, right? So the healing initiative is set up in the governor's office. That's what it's called, the Health Equity at All Levels of Government Healing Initiative in the governor's office. The healing initiative is charged with addressing racism as a public health crisis. We say it right there. It's part of the governor's office, providing it with significant authority and visibility, as we were told by other states was imperative. And it's going to draw upon the DPH staff and expertise. And of course, DPH does its own really critical health equity work. And the Office of Health Equity would be part of the way that the Healing Initiative would have the expertise. It's going to make data public and analyze data, collect data, and it's going to help state agencies. In the end, it's going to help state agencies organize their own health equity work. It's also going to develop over time a cross-sectoral strategic plan with the goal of eliminating health disparities and inequities, especially racial health inequity. So that's the first structure in phase one of the executive. In the second bullet point, right under phase one, you see that we established two other boards. One is the interagency task force and the other is the oversight board. So the interagency task force facilitates collaboration among the state agencies, right? So we say, oh my goodness, there's so many state agencies, let's help you organize yourselves. And that's the interagency task force. And the membership consists of the governor and representatives from each of the secretariats, right? So just what the Health Equity Task Force told us to do. And again, this was just beautifully synergistic since these were happening at the same time. And the interagency task force is charged with identifying barriers and opportunities for coordination. And they develop shared metrics and facilitate data sharing. So we have them saying, okay, we have a stated goal by the Healing Initiative, and now we're going to operationalize that goal through the interagency task force. And then, and perhaps most importantly, the oversight board holds us all accountable. So the membership of the oversight board consists of representatives from community groups, reflecting rural and urban, communities of color, faith-based groups, groups concerned about seniors, about mental health, about people living with disabilities, about folks who are currently incarcerated, and so many more. The membership is quite broad. And again, we received a lot of counsel about who should be on that. And the oversight board advises the initiative and the task force. It has the ability to hold public hearings, to shine spotlights on the work of the Healing Initiative, on the interagency task force, and hold it all accountable. So that's the executive in phase one. The legislative in phase one begins again with this kind of culture change, and it's reacting to the executive in phase one. So the legislative says, okay, everyone, here is an opportunity to evaluate the health equity impact. It's an optional ability right now in phase one. Let's review the health equity impact of the legislation and budget decisions that are moving through the legislature, right? Let's start the conversation in the legislature. And there's lots in legislative phase one about building capacity in the legislative branch. It also is a partnership, sets up a stated partnership with academic institutions. Academic institutions can be among the partners that are leading the evaluation of legislation, of budget priorities in the legislative phase one and phase two. So again, many of you here may come from academic institutions. This is the way we see ourselves holding hands as partners in this work. And then let's go back up to the executive in phase two. In phase two, the executive branch actually completes health equity plans, and these are reviewed by the Healing Initiative and the Oversight Board and implemented by the Interagency Task Force. So there's stated goals, right? To eliminate racial health inequities in the Commonwealth, to create a Commonwealth, a context, a foundation where everybody can thrive equitably and be their healthiest selves. And so that in phase 2 happens. And then in phase 2 in the legislative, this optional review becomes a required health equity impact review. And right now we've thought that a good threshold is a decision upwards of worth about $50 million, so that we could weed out the really consequential decisions in policy. But of course, everything's open to change, and your good counsel. And then there is a stated determination where the legislature will have to make a pronounced integration of health equity into decision making. So we'll have to be accountable publicly for the health equity decisions we are making as a legislature. So again, 3 principles and 2 phases, both in the executive and the legislative branch. So that's a lot. And I'm gonna stop sharing my screen really soon, and so we can have a conversation. So again, here's the timeline. During 2020, we researched this, we met with stakeholders, got a lot of counsel from folks like you, introduced in 2021 with Representative Liz Miranda, who is just a rock star on health equity. It was referred to committee in April of 2021. The advocacy in the base building continued, because that's, this is the thing about democracy, right? The legislature works best when people are pushing in, making us work, holding us accountable, like the oversight board. And in October 2021, we have a hearing. So that's Thursday, actually, as it turns out. And then our hope is that we work with the Health Equity Task Force leaders, with the Joint Committee on Racial Justice, which is a newly created, committee. I'm also a member of that committee. I asked to sit on that committee. Hopefully there is a strong synergy between all of these, plus a lot of push from the outside, from folks like you, and the legislature moves forward, perhaps not exactly as prescribed by the HEALING Act, but in ways that get us a health equity at all levels of government commitment. So we'll put our emails in. I'm muted by accident. We'll put our emails in the chat. And now I'd love to just have your questions. I saw some come in the chat box. Questions and discussion. We'll talk next steps. And thank you so much for the opportunity to share.
One thing I want to add is, among the people in the Zoom here is Carolyn Horo, who was a law student who helped us immensely with the drafting of the bill.
Oh,
so
my goodness.
Thank her publicly.
Thank you, Brian. I didn't realize Caroline was here, and I didn't know Dr. Robinson was here. I just saw you turn your camera on. So you heard your name mentioned, sir, numbers of times. Thank you for your leadership, Frank. I'm deeply grateful. So let me look at Risa, are you going to help wrangle?
I am. I just wanted to make sure you were all done there. And thank you so much for that great overview. There's a lot there. So I'll start with a few questions and people can keep adding them into the chat. One is just, why are you introducing the bill now? Do you think things have changed that might make it more successful? Or if you could just give us a little background on that.
So the bill got in, government moves too slowly. The bill was introduced in January of 2021. And so it's been grinding its way through the legislature. Our legislature has 2-year sessions. So we're not done yet, and nor should we be in this session. I introduced it really, and Brian and Caroline, you should, chime in. I mean, it felt like the only morally, ethically, socially responsible thing to do, watching COVID ravage us so inequitably, seeing the disparities across race and ethnicity. How could we not, as a legislature, do everything we could to prepare for the next pandemic, the next moment of great turmoil and strife in the Commonwealth? It's hitting us inequitably now because these inequities were so clearly with us for generations. So we have we have to address the tragedy of COVID by trying to heal these inequities. And so that, that was the thing that was motivating us as we were ending the last session and helping to wrangle the Senate's COVID response. We thought, what could we do? What contribution can we make? And Caroline and Brian and others started to do the research and speak, Reese, as you know, to good folks in Western Mass, and really think about what was happening in other states and how other states were responding to racial health inequity. And what could we do in Massachusetts to join them at this racial justice moment, this apex moment that we've been experiencing in our nation.
Great, thank you. Here's a different sort of follow-up question. How will success be defined? Is it looking at a period of a few years or annually? Very good question.
So the strategic plans have, they're over 5 years as defined in the bill. But, I think this is a very good question. I think in the short term, I will say success for us and those of us here who are interested in the health equity at all levels of government kind of work. Success will be defined by the legislature in this very narrow world, right? I'm in a very narrow legislative world. You all are in many other exceedingly important roles. Your advocates, your experts, your practitioners, your researchers, your students, right? So you all, everybody has a role to play. In my little weenie slice of the world, success would be defined by the legislature actually getting real in policy and establishing a health equity at all levels of government commitment, where we actually answer that question. What would happen in Massachusetts if we leaned in every time a policy or budget decision helped the inequities, right? Helped heal the inequities, and chucked them if they didn't. It's a bold question, but that's the kind of question we have to be asking. So in the narrowest terms, some sort of passage. Again, it doesn't have to be this bill. It could be other bills. It could be an adoption of the Health Equity Task Force report writ large, and a work to chip away at all of the recommendations. And again, some of those are being worked on, actually right now. And then longer term, this is where advocates would have a lot to say. The oversight board would have a lot to say. Over longer term, a timeline set by advocates and experts in the oversight board would set measurable goals for us to achieve as a Commonwealth in terms of racial health inequity. That those early indicators that I showed you, again, those were moving to me. And some of what Caroline and Brian and others looked at when we looked at just the disparities in Massachusetts long before COVID hit our shores, we would have to make measurable progress on the data that would show us whether or not we're achieving greater health equity.
That's great. And I think a linked question is, do you think that this will impact speed of response in crisis situations?
God, I hope so. Right? I mean, I hope so, right? That's if we're organizing ourselves around a principle of success looking like greater racial health equity, if that's the organizing principle, then it would have to follow that it would drive actions that would, again, make it intolerable for disparities in testing availability, disparities in vaccine distribution, disparities in hospitalization quality or the quality of service received at hospitals. The length of time with which we understood that and then acted on it, that length would have to be intolerable.
Just add, government does what it's set up to do. You need a structure. If there's no structure to worry about a problem, government doesn't worry about a problem. And if there is an agency, if there's a structure, if the legislation sets up a requirement with accountability, with some feedback mechanism, and something happens if you don't do it, then the agencies do it. I think state agencies it's tough to get them to do something new, and that's why this culture issue became so important to us. But if there's a structure and a new challenge arises, they'll respond to it. That's the concept. That's the paradigm that the bill sets up.
Thanks, Brian. Yeah, absolutely right.
That's helpful to hear. Well, let's see, two questions I'm choosing between, but Frank Robinson, he mentioned earlier, Dr. Frank Robinson is on the call, and he asked this, or says, how do we really get the state agencies to work together? In 1976, I was involved in area planning strategy teams, my first exposure to state agencies coordinating and working together. I'm still waiting to see meaningful cross-agency collaboration. Go.
Dr. Robinson, do you want to speak more to that? You know, because your experience is so critical.
I think Brian answered that a bit. So I've dated myself now. I've taken myself back to 1976, and probably some of you folks probably weren't even born at that point. I worked for this Mass Department of Public Health, mental health at that point, and we were heavily involved in Brewster v. Dukakis and the other consent decree at the state hospital. And there was this action to put these strategy teams together, and that it would be state agencies coordinating, working together to deliver services in a more coherent way at the local level. And so it never happened. And since then, I suspect there have been many attempts, but there's still a very siloed, very independent, and sometimes competing programs delivered by state agencies at a local level. So I'm just wondering what will be different in this push around interagency cooperation, and maybe Brian's question around structure and accountability that's built into the act might be the answer, if it is in fact there with teeth. So I'm not sure if I'm answering my own question, but
no, you're asking the question, and I do think what Brian said, Dr. Robinson, is quite right. The government responds to structures that are set up for it to respond, and one of the things that Caroline, I'm going to, I know you heard this in triplicate when you were doing some research state by state, is that it's imperative. This kind of collaboration, this kind of strategic plan can't be buried somewhere down in a sub part of any agency. It has to be at the gubernatorial level. It has to be held as a gubernatorial state priority. So I think that's one thing that's different, that we would elevate it up, right? And the other thing is, I do think that the way in which, and again, with great counsel, we've structured the interagency task force is actually really would give it quite a lot of both visibility to the gubernatorial level, so pretty high up in terms of making this a pretty high up state policy, a priority, but then also we've given the interagency task force an oversight board to hold it publicly accountable. And we've given the oversight board quite a lot of public power to judge, to review plans, to reject them or edit them. So the hope is that the structure is robust enough, not duplicative, because we didn't want to not respect the work of the Office of Health Equity currently and DPH, again, doing really important work, but instead sort of pull that in to a structure at a higher secretariat and gubernatorial level. And the hope is that we would have set it up to really prevail, as you say, in ways that we haven't yet been successful at that kind of collaboration. You're quite right to be skeptical of this. And then there's this piece of culture change, right? Where we really have to, I didn't get into, it's quite a long bill, and I didn't get into a lot of the ways in which the culture changes in Massachusetts if we adopt this racial health equity as an organizing principle.
Mm-hmm. Great. Well, thank you. Thank you.
Well, thank you.
So I think this is attached to that question, which is just more about, is there other teeth in this, along with what you just said about the robust, the plan that you have? And is there a previous experience with environmental impact assessments that inform the implementation of of healing and how that's going to work? Like, what has the past taught us about how to make this stronger?
Yeah, no, really good question. And Brian, I'm talking a lot, and Brian and Caroline, if you want to jump in, you should. So first, it's held in two branches. It's co-equally held. That doesn't always happen, right? The legislature acts in its own silo, the administration acts in its own silo, and here they are completely joined. And that's another difference, right? So the structures, the healing initiative, the interagency task force, and the oversight board on the executive, and then in the legislative, the structures that would encourage and then mandate chairs of joint committees or individual Senate or House committees to get health equity impact assessments. That would be, again, a role for academia, if academia thought that that was good, or a role for other kinds of researchers, which would be doing that work and then feeding it up to the executive and feeding it to the legislative branch. And I think, again, I haven't seen other environmental assessments that are held equally between legislative and administration, and that really have a stated commitment to data, publicly tracking data with goals and benchmarks outlined, and then accountability from the community, immediate accountability should we slip off our strategic plans. I'm not saying that I can guarantee this being the answer for us. It's one proposal for us to consider.
The other thing I'll just throw out there is environmental impact reviews have turned out to be enforced a lot by the court system. And if an environmental impact review says building this bridge will be bad for the water quality, the state agencies have to consider that seriously, and they can't build that bridge unless they've dealt with it. This structure was not a court-based structure. We didn't think lawsuits was the way to go here, but it becomes part of the kind of substructure of what state government has to do. And, if push comes to shove, maybe there'll be lawsuits and stuff that in the end save the day. We don't know, and it's hard to know. But we started with culture and getting, if the governor says, screw you to this whole thing, it's very hard to make that happen. But by building a culture where the bureaucracy, the agencies, the whole system is built on making health equity part of the checklist that you do when you propose policy, then it gets built in from the ground up. And so you have top down and ground up. We hope, I guess, that this will be if implemented correctly, this can really make real difference.
Can I just say, can I build on that, Brian? Thank you. That was really good. Right now there are people in the legislature and in the administration who are talking in pronounced ways about how do we, for example, evaluate the efficacy of our ARPA spending. Senator Sonia Chang-Diaz laid out an ARPA report card where we could decide whether or not the $5-ish billion that we're going to spend was actually furthering racial justice. Hers is not only in a racial health equity paradigm, but still it's completely a related effort. And Sonia's idea, Senator Chang-Diaz's idea, is critical. You can imagine something like this being sort of organically emerging from, as Brian said, these mandatory policy reviews that would start to be standardized. Remember, in other states, they're doing them, 84 in one state, 91 in another, and these are recent initiatives. So you can just imagine if we had that built in, where we start to have a report card, basically, which is the second phase of the legislative, like, hey, gang, there's a strategic plan at the state level. Is the legislature's work actually getting us closer to that goal? Are these policy decisions going to move those metrics? That's the kind of, I think, much sharper decision. So it's not just held by an individual inspired legislator, but it's mandated for all of us to have that conversation and to be accountable.
That helps.
The other thing I'll just throw out, it's a semi-cynical, but an aphorism I learned decades ago, is that politicians act differently when they know they're being watched. And this sets up a structure so they're watched very carefully by folks who share our values and want to see the right thing happen. And this makes me optimistic that if we were to get something like this doesn't have to be exactly, but something like this, it would drive real change, like I said.
That's great. Thank you, Brian. I know you mentioned bringing in lots of parts of our communities, and someone is asking how to bring in cultures of homeless people, people who are homeless, people in recovery, and those with mental health challenges. How will they be folded into the thinking?
Yeah, I wanted to ask Caroline, I think there's some references on the Oversight Board membership. Do you remember? I was going to look it up and then I was running around, but I think definitely mental health concerns were part of the Oversight Board, I believe.
We did. We tried to select groups that would represent a variety of populations that had historically experienced marginalization or oppression. And I do not remember the list at the time, but I do believe that homelessness and mental health were considerations that we incorporated in there.
Yeah, I think it's a really good question, right? If we don't have, and one aphorism that Brian might say to us tonight is, Brian, of course, has been at Senate Ways and Means for years, and has a rich career in the legislature before coming to our team, Healthcare for All and other great organizations. No bill ever comes into the legislature the way it comes out of the legislature. So your questions tonight, if you look down at the pad of paper I'm writing on, it's questions for me to raise with Brian and Caroline. Caroline, we'll have to pull you back into this work. But, just making sure that your concerns and your questions, every time we share this bill, it gets better because your concerns and questions and ideas get rolled into it. And we have to ask ourselves, did we do this? Did we address it? And the makeup of the Oversight Board was pretty carefully done. And we can ping the link of the legislation. Maybe Brian, if you don't mind grabbing that, we can read that, in more detail.
I did.
Oh, you did. Thank you.
Just to comment as well. I'm hearing there's going to be some kind of impact assessment process around upcoming policy or budget actions. In the health impact assessment process, there's a very early stage of scoping the work. And the scoping process requires broad community participation and input. So to the earlier question, if this process is as well defined as that and requires that early stage scoping by community, then that's where those voices, at least initially, show up and the process itself has the ability to check back in with them at later stages. So I think we can define a process that absolutely includes a review that's centered by people that are to be impacted most by a particular policy. So again, just mirroring the health impact assessment process that we used in Springfield when we took a look at the casino.
That's a great idea. That is, so we didn't go so far in the bill as to stipulate how an academic assessment would be, in a sense, I'm going to use the word graded, but it's not graded, as you know. It's how it's evaluated. But certainly putting front and center a review of the process that created the bill. Who said the bill was important? Why did they say it was important? Are they at the center of the creation of the legislation? Many bills, as you know, Dr. Robinson, are driven by people in local communities with good ideas, with lived experience, who say, this is ridiculous, you have to do this. Not all bills are, though. And so that's actually a spectacularly good idea, that part of what we could encourage in the bill, and we'll have to look at the language, would be an assessment that would look at the whole creation process of the legislation, from the onset of the creation of the idea, which can take years to spark, all the way through the writing and the hearing process and beyond, as we think about the impact. It's a good idea.
So I'm just going to close with action step questions that people submitted, and you sort of could take them all at once. But some people live with in Massachusetts with other state senators, and how do students, faculty, and staff, and the general public find out if their senator supports this bill or bills generally? What advice would you give students to try to influence their state representatives and senators? How can faculty or students and the community support this bill on Thursday? Is it too late to volunteer? And I know you said it isn't, so if you could comment on that. And then, do you have a sense of how likely or not it is to pass and what we can do to help? So
these are good questions. Brian pinged the link. So the HEALING Act legislative, right above Brian's first link, or the one that I can see now in the chat. It'll say S1388. Remember, that's the Senate bill. Rep.
I
Liz
sent it
Miranda,
again. I just sent it just now.
okay, you just said it again. Good. Rep. Liz Miranda has the House bill. They're identical. Sometimes there's only a Senate bill. Sometimes there's only a House bill. Sometimes there's both. And we wanted to work with Rep. Miranda, who we love. So we did this together. So you can see whether or not you're a senator or representative. And Brian, can you ping Rep. Miranda's bill number 2? You can see whether or not they've co-sponsored the legislation. And so you'll know whether or not they've done that. And if they've done it, you can say thank you. You can say that there's a hearing this week that you hope you chime in with the committee on the bill. If they haven't, you can ask them to co-sponsor. If you're inclined, I don't want to presume. You can absolutely submit testimony. It is not too late. And Brian put the HEALING Act hearing information. You can click on that and you can absolutely email the Joint Committee on Public Health. You'd be emailing me as one of the chairs. That's good though, because I can show the emails to the Senate President and Senate leadership. That's important. Just like the Dean's op-ed is important. Just like the Health Equity Task Force recommendations are important, right? These are signals to the legislative leadership that people care about this. Oh, thanks, Laura, for the legislator, how to find your legislator. And so you can do that, and so it's very timely. You can do it. You can submit testimony all this week, and it can be 3 sentences. I need the health equity at all levels of government to pass, because it doesn't have to be an arduous task ahead of you. And Brian just pinged the House version. That's Rep. Miranda. Again, the bills are completely identical, but you can look for co-sponsors in both bills. And then how likely it is to pass? Well, I will say that I'm emboldened by the Health Equity Task Force. I'm emboldened by the Deans of Public Health organizing themselves by this evening, by the Racial Justice, the Joint Committee on Racial Justice, chaired by Senator Sonia Chang Diaz and Representative Bud Williams. We should all feel emboldened by the kind of advocacy and awareness and unwillingness to settle for status quo anymore in the Commonwealth, right? That's what I feel bubbling up. So I'm hopeful that we will take action. But I'll leave you with this: the legislature moves when people make us move. That is the truth. That is actually the only organizing principle of the legislature. We move when you tell us to. As Brian said, we're politicians. And that means in our best terms, it means that I work for you. And other people work for some of you. Those of you who are constituents, you're my boss and you tell me what to do and I do it. Same thing for those of you who would ask your legislators to do it. And that is just absolutely critical. And the louder and the more resolute and the more unrelenting and the more passionate and the more single-minded we are about racial health equity, the closer we will get to achieving it in the Commonwealth. But it is absolutely going to take all of us. And we stand on the great shoulders of so many here. And I'm very grateful for this time.
Well, Joe, let me just say thank you so much. And Brian and some of our advisory board members who joined us, Frank Robinson and Jeff Harness. for being here tonight and inspiring us. And thank you for your leadership on this topic, because there's nothing more near and dear to our heart as public health professionals to sit there and say, enough is enough. We need to do something, and the time is now. Racism is a public health crisis, and I'm so honored to have you serve in your capacity and to lead us. So once again, thank you. And if we could all give a round of applause to Senator Comerford, and we wish you great success. We will be there to help support you, and good luck on Thursday. And thank you everybody for attending. Thank you, Risa, for moderating. Really appreciate everybody's support here. Have a good evening.
Thank you so much. Thank you, Dean. Thank you, Risa. Good night, all.
Good night.